Good afternoon, and thank you for joining us for another opportunity to talk about the COVID community conversations here in Franklin County. My name is Belinda Hodges. I'm one of the deputy chiefs for Franklin County Public Safety. We're going to bring you today some information about proper mask fitting and the latest updates from the governor. First, I'd like to say thank you to a few people. First of all, to the frontline workers who are providing care for these patients from home to the hospital and in between. Your work is helping a lot of people recover from this, and we do appreciate that. And then also a special thank you to the people who are not seen so much, our dispatchers, who are asking extra questions. If you've called 911 recently, you will notice they're asking extra questions, screening, so we have information as law enforcement, fire, and rescue to be able to come out and take care of you and respond and protect ourselves and our families at home. One of the hot topics, I'm sure, is Governor Northam's speech yesterday, where he announced that we would now begin a statewide mask mandate. And I'm going to read the information that we got from our Virginia Emergency Management Association. It says, Governor Northam announced a statewide mask mandate that will begin this Friday, May 29th. The mandate will require anyone in an indoor public space to wear a face mask or face covering. This includes places such as a store, restaurant, public transportation, government building, or anywhere people can congregate in groups. There will, however, be some exceptions like eating, exercise, health conditions, and children under the age of 10. Additionally, the Virginia Department of Labor is now developing COVID-19 workplace safety emergency standards that will be applicable for all employers, employees, and places of employment. These standards will address PPE or personal protective equipment, sanitization, access to employee exposure, and hazard pay. This is all still being finalized and will need to be approved by the Virginia State and Health Codes Board. So more will be coming for businesses and those employers and workers out there. So with that, we have a lot of questions, and a lot of people are going, okay, well, I've never wore a mask before. How do I do this? What kind of mask do I require? The first thing is be sure that the mask properly fits your face. As you can see from the display here, we have a multitude of different masks. We have masks that are already shaped for your nose. We have masks that are flat. We have masks that have eye shields on them. And several different other types of masks that you have to form to your own face. And then the simple one, which is great. And you can see a lot of kids wearing these. They're very simple. You just slip it on around your neck, pull it up over, and it nicely fits. Notice I put it under my glasses, so when I'm breathing, it's not fogging up my glasses. Those can be bought at Walmart, very simple, or any place where you can buy those. The big thing is to make sure that your mouth and nose are covered and protected. You don't want to breathe in any potential for contamination or infection. These type of masks, you have two. These can be bought at a simple painter's mask. Sometimes you can find them at Lowe's or so forth. They have two rubber bands on them. Simple, easy fit. Put your fingers in through, put your chin in the mask, loop it over. And this one was bridged, but the best way to make sure it fits properly is bridge it to your nose. This is the same exact type mask, but it's already bridged. But this mask is too small for my face, so that mask would not work properly. If you have a mask that has a colored side or a white side, make sure the colored side is out and the bridge, or there's a thin metal piece here. This will fit over your nose, bend against it, put the ear loops, and then pull this down and around. Again, keep it tight against your nose, and then you won't fog up your glasses. That's my biggest problem with wearing a mask. I'm always feeling like I'm fogging up. Okay? The colored side should be out, and the vents should be pointed downward. Okay? The big thing is just to make sure you have your mask on. These masks are very hard to find because a lot of times these are the ones that the healthcare workers are required. Similar to this one, but it has two rubber straps. Fits down like this. Again, same way. Put your chin in. Stretch it over. The lower band goes under your neck, and this part sits on top of your head. Again, pinch it to your nose. You shouldn't be able to feel any air coming in and around if you feel it tight against your face and it's against your nose. Now, if you're claustrophobic, these are kind of hard to deal with. A lot of times these are a little bit easier to deal with, the flat mask, if you're claustrophobic. This mask is exactly the same as this one, it just has eye protection. You probably won't need that going out in the public, okay? A lot of times as fire and rescue workers, we use those if we have to get some splashes into our face. We will be taking questions while this is going on, so if you'd like to call in, leave us a question and we'll check on some of those as we go into breaks. All right, well, welcome back. So a few minutes ago, we talked about the proper way to wear a mask. And for some of you, you've been doing this. You've been wearing them since March, or healthcare workers, you've been wearing them since day one that they started. So let's talk about some of the improper ways to wear a mask. Ways that you've got it on your face, but it's just really not going to do any good for you. Okay, so we talked about how this mask has a metal piece across it and it's flat. Well, simply putting the mask on like this is not going to work. You notice you have a gap here, you have gaps here, and you have gaps here. All areas where you're going to breathe in that outside air. So please make sure that you are wearing the mask and it's proper again. Now, lots of times you see this. Well, guess what? You breathe in through your nose as well. Wearing it down here is not going to protect you if you're breathing through your nose, okay? Unless you can figure out how to only mouth breathe, this is not going to work. All right, so please make sure you're bringing it up over the bridge of your nose, covering it well, and down over your chin. Is it comfortable? No. Is it pretty? No. Is it going to protect you and keep you safe? We definitely hope so. That's the reason that we want you to know how to do this, okay? They're hot, they're uncomfortable, but they're for your protection. Other ways that I've seen people wear them that are not proper ways. This is a mask and you're wearing it, but it's not going to work either, okay? Make sure you have it on you, all right? These masks, again, when they come, they're flat across here. If you don't put it against the bridge of your nose, it's not going to work. If you only have this part hooked, this part can come loose and flop. You want to make sure you have both pieces across. Okay? Make sure you have both pieces across and it's across the bridge of your nose and it's properly seated. Okay? If you are a person who wears oxygen and you are going to have to go out to a doctor's appointment or to the pharmacy or wherever, and you need to wear a mask, put your oxygen cannula or whatever you need underneath and make sure you put the mask over top, okay? It's hard enough to breathe if you have to have oxygen, but please make sure you put a mask over top as well, all right? When you're out in public, we want you to be protected. All right, so we've talked about masks and about what the governor's got coming Friday. So I'm sure now we'll see all of you out with your proper mask on in the proper position. Thank you for that. And if you have any questions, you can always call our office and we can give you some other tips. Or you can look it up online. I'm sure it's on YouTube, everything is. All right, so I looked on CDC about some things to talk to you about to try to control the COVID rumors. Everybody's nervous. Okay, the state's opening back up. We're starting to go out in public. What's going to happen? And we see a lot of, this race is affected or this ethnicity is affected or this age group. This disease is affecting all kinds of people from young to old, and we want everybody to be safe. So even though the mask is not required for young ones, if you've got young ones, I have an 8 and 9-year-old grandson, they put these masks on, they feel like they're little superheroes. So if you got kids and you are taking them out and it's going to be in a large public area, please put something over them if at all possible. The immediate risk of becoming ill is thought to be low. But people with underlying medical conditions, older adults, have a higher risk and serious complications. So if you don't have to go out, please don't. Please reach out. There are a lot of volunteer groups and community groups that can hopefully bring you what you need or come into you. We are still doing meals in several areas of the community. We can get those hot meals that hopefully somebody can come out and pick up for you. Some simple things to do to keep yourself and others healthy. I know you've heard this 100 times. Wash your hands. If you have soap and water, that is the best thing to use. You see hand sanitizer being scooped up constantly, but if you can get in touch and get a hold of soap and water, hot water and soap for 20 seconds is great. But if you only have hand sanitizer, use it, but then get to soap and water as soon as you can. When in public, wear face covering. Well, that's coming from the governor now on May 29th. Avoid touching your eyes, nose, and mouth with unwashed hands. Well, we talked about nose and mouth. Why about your eyes? Eyes have a way of also soaking in bacteria and infection. So that's why we want your hands away from your eyes. Stay home when you're sick. Everybody's excited to get out. We all have been cooped up in quarantine, but please, if you're sick, stay home. And then, of course, all of us have been told this since we were little. Cover your mouth when you cough or sneeze. So please follow these. Try and know the signs and symptoms of COVID. If you have questions, you can reach out. The health department on vdh.virginia.gov has a whole section on coronavirus. If you're going on the website or on the World Wide Web, please make sure you're using a reliable source. But the signs and symptoms to look for: fever, cough, shortness of breath. If you're having medical or extreme shortness of breath, trouble breathing, pain in your chest, signs and symptoms that are really concerning to you, seek medical attention. Reach out to your doctor's office. I know a lot of them are not open for walk-in patients, but you can call their offices to get information. Some of the other things that a lot of people have been dealing with, and it's something new to us that we're not used to: staying home, coping with stress on how to deal with all these new changes. And that's from all age groups, young, old, and so forth. Who would have ever thought that we all had to become teachers at the end of a school year? I never realized how much I did not know about 4th grade math or 3rd grade math. Thank you to the wonderful teachers who were able to adapt and adjust so quickly to be able to get our students through there. And also congratulations to the graduates. It wasn't the graduation you were looking at, but you did well. Take care of yourself and your community. Reach out to those you know that are sick or unable to get out and about. Make sure they're taking care of themselves. Make sure they're able to get the things that they need. Take time to unwind. Don't focus on every news channel that you see for coronavirus. It will drive you crazy because everybody is talking about it. Connect with others. Talk about how you're feeling. There are a lot of resources out there. There's a lot of scary stuff about this virus that we do not know. Virginia 211 is a telephone number that you can use. The CDC has great information. The Department of Health has great information. A lot of this is a new thing, outbreak that we have not dealt with before. We worry about our own health. We worry about the health of our loved ones, especially if we have someone in a nursing home. We've seen a lot of outbreaks there. So take care, and we're not able to get in and see our loved ones that we've been able to see before. Changes or sleep or eating patterns. Maybe you're not a person who likes to cook. I don't like to cook. Maybe you depended a lot on going out to eat, and now you've had to make that whole change. Difficulty sleeping or concentrating because of your worries over COVID. Worrying about health conditions. Do I have this? Do I have that because of everything else that's going on? Work with your doctors and find out what the information is. Research the information. Check in on your loved ones. Just because you can't see them face to face, I've seen so many creative ways that we can communicate and get together. One that I saw on TV the other day, they had put up a way for a grandmother to come in and hug her grandchildren through a plastic screen with sleeves. It was great. Video chat. We have all means of technology. Social media. Go back to the old times, mail a letter or a card. They still sell those. The mail will run. So please make sure that you're trying to reach out to each other. What can we do to help you? Please call in if you have questions. We would love to hear from you. If there is anything else that we can do, please try and let us know. You can reach us at Public Safety at Franklin County. It's 540-483-3091. Again, like I said, for the Virginia Department of Health, they have Virginia 211 or VA 211 as an information source line. And we look forward to talking to you again on our COVID community relations. Thank you so much.